I'm Joe O'Connor, Editor-in-Chief for the Explore Big Sky newspaper. Today is Tuesday, March 17th, St. Patrick's Day. But the mood here in this small town is a bit different than it's been in years past. Last Friday, Gallatin County recorded the first positive case of COVID-19 coronavirus, and the news flew through this community at an incredible rate. Big Sky Resort suspended its operations on Sunday, March 15th, and last night, Gallatin County ordered all restaurants and bars to close down at 9 p.m. We live in a time of uncertainty. We have questions and we want to get you the answers, so we came to the source. We're here at Big Sky Medical Center to talk with Dr. Phil Hess. Dr. Hess, thank you for taking the time to talk with us today. We're in some uncertain times here with the COVID-19 coronavirus. And while there are no confirmed cases in Big Sky currently, one has been identified in Gallatin County. I'd like to know what measures Big Sky Medical Center is taking to prepare for any potential cases.
Well, it's taken up a lot of our time and our effort. We are taking it really seriously. We have a lot of help and guidance from Bozeman Deaconess and their preparation efforts, and we're trying to sort of work along with them, follow their lead. We've set up incident command in Bozeman and also have a structure for that here in Big Sky. Basically, it involves a lot of information from the CDC to county health to all the healthcare facilities in our system and Big Sky in particular. A lot of the preparation is focused on how we're going to deal with an increase in really sick patients when it happens. And it's likely to happen. We have really stocked up on our personal protective equipment. We've set up areas within our physical space for sick patients in the waiting room where they're separate from other patients. In our care areas in the clinic and the emergency room, we've done the same. So we have sort of separate areas for respiratory patients to be evaluated and cared for, and then a decontamination and infection control procedure for each of those areas after a patient visit, and identified appropriate protective equipment for all our staff to wear when they're giving care.
What does that equipment look like for your staff?
Well, depending on the level of exposure or any procedures necessary, it might range from anywhere from a glove and mask for the care providers, all the way up to full protective gear that's virus-proof and recycles the air in any procedure where we might expect that there would be more respiratory secretions involved. Say if we had to intubate a really sick patient, that would require a much higher level of personal protection.
Gotcha.
For patients coming into the facility, anybody with a respiratory complaint, basically we'll ask them to wear a mask and to keep them in an area separate from the rest of the folks who are coming in and out of the hospital.
I think that's really helpful for people to hear. That kind of that interaction, that what does it look like if and when? It's very helpful. What advice do you have for anyone feeling, sick or experiencing symptoms that could potentially be related to COVID-19?
Well, probably first and foremost is just sort of relax, take a deep breath, and look for the references and resources that are already available out there. I mean, there's tons of things online. The CDC website has a lot of useful tools for patients who are concerned about infection or having symptoms. And within our own organization, we've set up a nurse call center so that patients calling into a clinic or their regular doctor, if they have concerns about COVID-19, then they'll be routed to the call center where the nurse is like, this is what they're doing, is given advice to patients with concerns about it. So based on the level of symptoms and risk that a patient might have, then they'll be directed about how to proceed. And that might be anywhere from just staying at home and protecting yourself to coming in for assessment if they're at higher risk or displaying other certain symptoms. So we have things in place to kind of help people sort through the decision so they don't have to immediately run in if they have a cold and potentially expose themselves or use up resources that might be needed to take care of sick people.
Yeah, absolutely. You mentioned calling in and that you have a call center set up. Is that what you are? Is that what you are hoping that patients will do? I mean, are you discouraging them from walking in? Is it more appropriate for them to call, explain symptoms to a medical professional, and then have them assess?
Yeah, I think we want to be a resource for people before they get to the facility. There's a couple of things that allows us to do. Number one is be prepared. If there's a group of people coming in at the same time, then we're already ahead of their arrival, making preparations. Another is it allows us to sort of triage patients before they get here. So if there's people who are mildly ill or at low risk, we're probably going to encourage them to stay home, take care of themselves, kind of self-quarantine like we're reading about all the time. And then if we do identify, concerning things about their symptoms that put them at higher risk, things in their history, a chronic illness where they are at higher risk for complications, then we're going to encourage them to come in. But we like to do that with a phone call ahead of time rather than people just showing up at the door anywhere along the spectrum.
Gotcha. No, that makes sense. At what stage are you encouraging people to make that call? Is it, I feel a little worn down, I have a little bit of a cough, I don't know, or is it, when do you encourage people to get on the horn?
Well, we don't expect people to come in with a whole lot of medical knowledge on their own, so I think I'd stress that we want to kind of meet people where they're at. And call with questions anytime, but we might encourage you to look up online first and kind of see where you're at from the CDC recommendations. Obviously, if people are displaying real serious signs and symptoms, and by that I mean chest pain, real shortness of breath, labored breathing, fever that's uncontrolled with Tylenol and ibuprofen, then we want to see those people. We want to make a physical assessment in person and figure out what's going on.
Absolutely. How comfortable are you all with the current patient capacity at Big Sky Medical Center? I mean, is there a plan in place to handle a greater capacity of patients should that need arise?
I think right now we're just about as well prepared as we can be. We have a relatively small facility, but we're used to dealing with high numbers of patients during ski season and at other times when we get a rush of pretty sick folks in the door. We currently have one ventilator on the premises to prepare patients for transport to a higher level. We've got 6 emergency rooms. We've got some overflow area in the operating room surgery suite that we built but aren't using for other reasons. We've got all the staff trained and fit for masks. So I think on our local level, we're doing really well and have easily been able to meet the need of questions and concerns so far. Bozeman, our parent hospital, I think, working with them, we've got the region pretty well covered. Bozeman's doing exactly the same thing, just on a bigger scale. And most of our sick patients are going to probably go to Bozeman, and we're going to work very, very closely with them for preparation and for patient care. And I think by all signs so far, we are where we should be.
Well, that's encouraging. You talked a little about the resources you have here. If someone has a non-coronavirus related need, can they come in? Can they schedule an appointment?
Yeah, absolutely. I think it's business as usual for the clinic side, for chronic care, for wellness visits. So far we have the capacity for that. I think if people have scheduled appointments or a need to see their doc for another reason, then absolutely we have the capacity. For emergency room, we're still seeing all the other patients just as we would before. I think what this situation does for us is it kind of puts a compressed time frame on something comparable to a flu season, whereas in a flu season we would see this illness spread out perhaps over 6 months. Well, with coronavirus, I think what we're seeing on a global scale is the whole season has been compressed into a month. So we're probably going to see that many really sick people. We're going to probably see that many people who need ICU care, but instead of over a longer time frame, it's being really compressed. So that's going to be the real strain for us when the wave happens, and for our resources in the region.
What else would you like the community to know? I mean, I think we've seen our Big Sky community come together in a lot of ways. You've seen this in communities all around the country, all around the world. To allay any fears, what messaging do you have for people?
Well, I think, there's a lot going on here. And where do we start? I think the first thing is to just recognize that we've seen situations that are similar to this before. Every few years a new coronavirus comes out. It was MERS a few years ago, and SARS before that, and it was swine flu before then, and that's an influenza virus, but kind of similar, comparable in my experience. So while it's a new virus, a new strain of the virus, it's not a new circumstance. We've been here before. We've managed this. We've all come through it. So that's number one. Like, this will pass. Number two, I think the really important take-home point is that most people that get COVID-19 infections are not super sick. They have a bad flu. They recover. And so it's really, I think, nothing to fear any more than a bad flu season for most people. Of course, the vulnerable folks, the elderly, those with chronic conditions, they're at higher risk, and we are going to see them. They're going to need care. But for most people, you'll get sick, you'll recover, and we'll be fine. I think to speak to the ideas of the social distancing and the need to sort of flatten the curve, spread out the illness and preserve healthcare resources, I'm fully behind that. I understand. But I think there's also a risk of kind of pulling back too much, and then we pay the price in other ways, economically, socially. And so while it's important to address the spread of the illness now, I think it's important not to go too far the other way and do damage in other ways, if that makes sense. I think the virus is going to make people sick, and we'll get through it. Our response to the virus, we need to be careful. We need to be appropriate, but we need to also keep the big picture in mind.
Right on. Dr. Hess, thank you very much, for your time, taking the time out of your busy schedule. We really appreciate it. And will we do this thing?
Yeah.
Does that work?
Thanks for getting the word out, Joe.
You're
I
welcome.
appreciate what your team's doing.
Yeah, sure thing.